Okay, so we're here to do the abdomen recipe. Unlike some of the other recipes that we've done, this one doesn't have a really hard cross-fibering circulatory aspect like some of our other recipes. So in this case, we're going to see that there are elements of sports and elements of circulatory at the same time. And when we do abdomen work, of course, our client's going to be supine in the face-up posture. In order to reveal the abdomen, we also do have to sometimes be able to cover the chest. When we're going to create a drape for the chest, we want to make sure first off that the drape that's covering the client has a nice strong and crisp line below their neck or below their chin. We're going to take our covering, which could be a towel or it could be a pillowcase or another sheet. We're going to let this sink just below the client's chin. We're going to take the hard line of our sheet or blanket and we're going to connect it with the hard line of the sheet, and we'll bring them both down at the same time. Once we've done that, you can secure the top sheet as you bring the drape down to reveal the abdomen, creating a tuck here, and you can take your top sheet and you can move it back up and create a covering for the chest. Okay, so now that we have our abdomen undraped, we can go ahead and begin the routine. All right, so the first move that we're going to do today is going to be a torso rock. So when we do a torso rock, we're going to be thinking about this as passively moving, and we want to create a nice movement for the whole body. So what we're going to do is we're going to create a push over the ASIS and the pelvis, and we're going to create a second push over the rib cage. Now more of your effort is going to go into the pelvis than the rib cage, and you're just going to use your stance to create a light rock in the body. You're going to find that when you do torso rocks, each client kind of has their own speed that their body naturally kind of rocks to. So if you can kind of find that, oftentimes it'll be the most comfortable for the client. Once we've done our torso rock, we're ready to proceed to the next move. The next move is going to be a cross pull into the latissimus dorsi. To do this one, I'm going to need to set myself in a bow stance. In this particular case, my bow stance is going across and just up the table. When I go for this pull, I'm going to have to kind of lift the client's body to put my hand underneath. I usually think of this as a 1, 2, 3. So here's number 1, I grasp and I lift. Here's number 2, I grasp and I lift a second time. And here's number 3, my big deep swoop. I let the body rest on my hand, and then I really slowly, I'm using my sticky force to really stretch and using my fingers flared out to kind of rake over the left. Once I'm out, I can do a 1, 2, go back in, a little higher up the body this time, a little bit more superior. Create a second rake, another 1, 2, and creating a third rake. So this is our latissimus cross pull. Once we've done the cross pull for the latissimus dorsi, now we're going to come back to the anterior of the body and we're going to address rectus abdominis. Now when we look at rectus abdominis, it helps us to kind of visualize where that muscle is going to be going. It's kind of got the central column of the front of the body here. And what I want to do is I want to use the heels of my palms to kind of scoop and push and hold it just as a light stretch. And then allow my fingers to go over, scoop, and pull for a light stretch. As you scoop with your palms, your push should be coming through your stance. And as you let your fingers drape over, you're going to scoop, and again, your pull is going to come through your stance, like you're sitting back into a chair. So we can do this a couple times. Good. Once we've done the push-pull of rectus abdominis, the next move that we're going to be doing is a compression into the solar plexus. When we're doing this compression, we're basically going to use our palm to sink down onto the solar plexus and then to create a push that pushes up towards the diaphragm. When you're doing this move, you do not want your force to push the ribs apart. So if you feel like your palm is getting stuck and starting to wedge the ribs apart, you might think about taking your palm and sliding it just a little bit more inferior of the body, or sometimes you might scrunch your palm up so it's not quite as wide. So what I'm going to do here is I'm going to place my palm over the diaphragm, or I should say over the solar plexus. I'm going to follow the client's breath, and I'm going to follow the breath as they exhale. I'm going to go a little deeper, and I want to think about giving the client time to acclimate to this. So we're going to take several breaths. You can think about it as being maybe 30 seconds or 5 to 8 breaths or so. We're going to get to a point where it feels like my palm has sunken into a pretty fair degree, 2 or 3 inches or so. Once I have my palm sunken into this compression, I'm going to use my bow stance, which is now facing up the table, to create a light push up towards the diaphragm. You want to make sure that this push is slow and gradual. Sometimes the pressure that's in this area can feel similar to the sensation of having the wind knocked out of you, so you don't want this to be a sudden move. If we do it gently, then it can also be a great release for the diaphragmatic attachments as well as the abdominal attachments of the ribs. Once we've done that, we're going to go ahead and allow our pressure to come back away from the diaphragm, nice and smooth, and we'll release our compression back up out of the solar plexus. And then you've done the solar plexus compression. So we're ready for the next move. Okay, so we're ready to do the lubricated movements of our abdominal recipe. So we're going to do more of our gliding strokes. The first one that we're going to do is going to be an array of strokes. They're all going to come from a central point at the bottom of the abdomen, and they're going to flare out in different directions. So you can see here, I'm doing this as a push this time with my bow stance facing up the table. Each one of my pushing, I'm using a light trench, more of a narrow tool, to kind of go in a slightly different direction. Now we could potentially do this move as a pull as well. I would stand in the opposite, bow stance facing down, and lightly pull. And again, notice that my palm, each pull is going in a slightly different direction, but they're all coming from the same starting point. Okay, the next move that we're going to be doing is palm circles over the abdomen. In this case, all we're going to do is sink into a horse stance. We're going to place our palms on the abdomen, and we're just going to go ahead and create a nice, broad, smooth, and slow circle. You'll have to lift your hand off once in a while, so that way you can continue to weave your hand over hand. But otherwise, this is a move I believe that you've probably seen before. When we've done our palm circles, the next move that we're going to do is going to be a trench of the costal cartilages. The costal cartilages, of course, are the ribs. What we're going to do is we're going to do a push across with a palm, but we're going to emphasize our thumb in this stroke. So even though we're doing a palm stroke, as our thumb finds the ribs, we're going to find a little crevice, and we're going to let our thumb just create a little bit of deep pressure, kind of like we're clearing out the trench. You'll have to do this move on both sides. Everything that we're doing on the abdomen pretty much is both sides at the same time, but this particular move you'll actually have to switch sides of the table to be able to do it to the second side. All right, once you've done the costal cartilages, we're going to move on to the next move. We're going to sit back into a light bow stance, and we're going to take our hand and we're going to do rolling knuckles over the navel. And again, this is less about being able to use your stance to push and pull and more about keeping your wrist light and flexible and allowing the wrist to rotate. You'll see I bring my knuckles and then twist the wrist over, bringing the knuckles through, rolling over. So just kind of keep that nice and light rotation through the wrist. And the last move that we're going to use to finish off our abdomen routine is going to be a light, almost an energetic trembling. Just over the umbilicus, just over the belly button. And this is almost like a settling, kind of a grounding type of a move. Great. And with that, you finish the abdomen routine. You can go ahead and redrape your client, and we're done.